Okay, so Navya and others, Arshal and others. So, okay, let me start the presentation. So, we discussed about pharmacokinetics, pharmacodynamics, and pharmacology. Now, we will see other branches of pharmacology. So, now you can see that there is one more branch what I have listed here. It is called as pharmacotherapeutics. Okay, so what is pharmacotherapeutics? Therapeutics means treatment of the patient, treatment of the disease, or treatment of any ailment. Okay, so this is more of an application aspects of the pharmacology is dealt in pharmacotherapeutics. Okay, so pharmacotherapeutics deals with application aspects of drug information and the knowledge whatever you are going to learn throughout the year. Okay, so once you learn this, you will be applying this using pharmacotherapeutic concepts. Maybe you might have seen that during my theory classes I told you that you need to, when you are writing, you need to detail. Okay, so indication, just mentioning the indication is not going to help. You need to detail in which condition you are going to, suppose congestive cardiac failure. Okay, so there are acute heart failure and there is a chronic heart failure. So as I discussed, in acute heart failure you can use beta block in the beta, that's the beta agonist or adrenergic agonist, and in chronic heart failure you are going to use beta blockers. So like this, what which are the condition, at what dose, what are the therapeutic aspects, what are the intricacies of all these aspects you are going to discuss in pharmacotherapeutics. Okay, so it deals with the prevention, mitigation, or cure of a disease, and also selection aspects, most appropriate drug, dosage, duration of the treatment in accordance with the specific features of the patient. So it means that individualization of the treatment is applicable by applied by using pharmacotherapeutic concepts. So you can see that therapeutics in which is guided by pharmacokinetics and pharmacodynamics, and so you will decide at what dose you have to give, what is the concentration, that is the therapeutic window you have to maintain, and what is the outcome that is expected. So like this, you will be discussing about pharmacotherapeutics and you will be applying all these concepts while treating the patient. Okay, so next aspect is clinical pharmacology. Okay, clinical pharmacology means it deals with scientific study of the drug, both for new drug and for the old drug also. Okay, in man, clinical means in man. Okay, so the clinical pharmacology deals with the study of the drug, scientific study of the drug. So you have already made the model. Okay, so in the model you have made that the drug development in man happens with the no, just 1 minute. Hello, Chandan, can you? Yeah. Can you call 77? Okay, 77. Yes, correct. Okay. Yeah. Okay. Sorry for the interruption. So what I was saying that you have already done one model. Okay, on drug development aspect related. So in that you have mentioned that okay, phase 0 of the clinical trial, phase 1 clinical trial, phase 2 clinical trial, phase 3 clinical trial, and also phase 4 clinical trial. Okay, or post marketing trials. Like this you have made one model, so it is dealing with the clinical pharmacology aspects. Okay, so whatever the model you have made, it is related to clinical pharmacology. So you can see here clinical pharmacology deals with the scientific study of the drug both in man, in for the new drugs and also for the old drugs in man. It includes the pharmacodynamic studies and pharmacokinetic studies. Okay, so as I told you that if a drug is already developed, then you may develop a new method of dosing, new for new indication or new disease or new population. Okay, so like this, you will keep on doing the research for expanding the indication of that particular drug. Okay, so generally these trials are done using the comparator. Okay, maybe comparator can be a placebo. Placebo means it is an inert substance or a active drug you may use, okay, for comparing the results. And also a clinical pharmacology can be done by doing surveillance is done by, like, pharmacovigilance. Pharmacovigilance is a kind of surveillance. We do the surveillance of adverse drug reactions of the drug which are already marketed, and also like what is the pattern of the use, whether which is the most commonly used drug, which is the most commonly used dose, what kind of population, whether it is used in males, females, or which kind of indication. Like this, we can do the surveillance of whatever the drugs that are used in the market. And clinical pharmacology helps us to develop the evidence. Okay, helps us to record the evidence, and based on the evidence we will be able to practice. Okay, so that's why clinical pharmacology helps in developing the evidence. Okay, it is based on it is a evidence, so it's part of the evidence based medicine also, and supports the generation of the data for optimum use of the drug and for the practice. Okay, next concept or next branch of the pharmacology is chemotherapy. What is chemotherapy? See, you will come across this chemotherapy very often, both in the treatment of infections and in the treatment of cancers. Okay, so try to understand this. Okay, so chemotherapy generally it refers to both anti infective use of anti-infectives or treatment of infections, and also for the purpose of treating cancers. Okay, so now let us try to understand more about this chemotherapy. Chemotherapy deals with the drugs used in the treatment of infections, malignancy, or with any specific drugs that are used for the killing of a particular microorganism or for the purpose of killing a malignant cell. Okay, and as you know that like infections are caused by bacteria, fungi, virus, and these bacteria, fungi, virus, they are the foreign organisms, they are not the part of our body right now. But in malignancy, all the cells which are going to trouble you, they are our own cells. Okay, so they are growing faster than required, that's why they are troubling us. So in that way, in malignancy, we are going to kill the cells which are growing faster, they are part of our own body. But in treating the infections, you are going to kill the external organisms. Okay, external organisms like bacteria or virus or fungi. So in one or the other way, chemotherapy includes killing of the cells. Okay, now I would like to tell you about what is pharmacy. Okay, so pharmacy means, like the moment I talk about the pharmacy, you will immediately understand that it is a drugstore. Okay, so but you should know a little bit classically what is the meaning of this pharmacy. Okay, so let me tell you about this. So pharmacy, it is the branch of pharmacology. It deals with the art and science of compounding and dispensing of drugs, preparing suitable dosage forms for the purpose of administration of the drugs to either to man or animals. Okay, so it is compounding and dispensing and preparation of the dosage forms for the purpose of administering to man and animals. Okay, so it includes the collection, identification, purification, isolation, synthesis, standardization, and quality control of medicinal substances. Okay, so please understand this. You see, pharmacy, generally it is written in more pharmacy store, you immediately connect that it is a storage of drugs, or it is, procuring and storing, but it is not that much only. Okay, please understand this. It is compounding, dispensing, preparing suitable dosage forms. For doing all these, you need to collect the dosage forms, identify the drugs, purify the drugs, isolate the drugs, synthesize the drugs, standardization and quality control of medicinal substance. Okay, so and also large scale manufacturing of the drugs is also involved in pharmaceutical sciences. So it is primarily a technology based science. Now I would like to tell you about what is toxicology. Okay, toxicology means it deals with the study of poisonous effects of drugs and other chemicals. It can be household, environmental pollutants, or industrial, agricultural, or any other homicidal poisons. Okay, uh, basically toxicology deals with the toxicological effects of the drugs, and also emphasis on detection of poisons, prevention and treatment of poisons. Okay, so generally you might have seen that forensic medicine and toxicology, that is what has been, it is already designated. So it is part of the pharmacology which is taken over by the forensic medicine. But if you see that most of the drugs and their poisonous effects are discussed by us, we talk about the what are the antidotes, what is the methodology used for the treatment of any poisonous effects or adverse effects, or any kind of like how to treat, how to prevent, how to manage the acute management of the disease and all. But forensic medicine and toxicology, what they don't deal only with the drugs. They also deal with the varieties of poisons. It can be organophosphorus compounds, or rat poison, or any other kind of poisons, or maybe like some with whatever the poisons can be used. Poisonous effects can be the result of maybe the result of both with like therapeutic effects, or for the purpose of any bad intentions also. So in that way, so toxicology, it deals with the poisonous effects of the drugs and chemicals, and also with the emphasis on detection, prevention and treatment of poisonings. Okay, so it also includes the study of adverse drug effects, since the same substance can be the drug or the poison depending upon the dose. Okay, so see what I'm saying, that most of the drugs, okay, so they have poisonous effects if you are not using in the therapeutic range, and they will definitely cause one or the other adverse drug reactions. So it's very important for us to know how to use, what to use, when not to use. Okay, so this is about. So now I completed the terminology related things, and just to quickly understand, and some quiz, let us try to enjoy the quiz about this. Okay, so true or false, pharmacon means formulation. Any of you? So can you unmute yourself? Can you unmute yourself? All of you, Akshay or Arshal. So you can answer.
Yes.
Okay, keep on answering. Is it correct? True or false? Pharmacon means formulation. Is it correct?
True,
False.
sir.
Yes, you
Yes,
are
sir,
right.
true.
So
False.
pharmacon means drug. Okay, logos means discourse. So pharmacology is the science of drugs. Okay, pharmacon means it is drug. Okay, next question. True or false? Drug is any substance or product that is used or is intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient. It means that, like, is it the true definition or false definition? So just read it again. Drug is any substance or product that is used or is intended to be used to modify or explore physiological systems or pathological states for the benefit of recipient. Is it correct or not? Any one of you? It is true.
True, sir.
Okay, it is true. Okay, so drug means it is a substance used for the purpose of modifying or exploring the physiological systems or pathological states for the benefit of recipient. Next one, identify the correct answer. What is the what the drug does to the body is indicated by, okay, what the drug does to the body is indicated by pharmacokinetics, pharmacotherapeutics, chemotherapy, pharmacodynamics. Which is the correct answer?
Pharmacodynamics.
What the drug
B.
does to the body?
Pharmacodynamics.
Yes, all of you are correct. Very good. So very good. So it is what the drug does to the body is pharmacodynamics. Next question. Following are the components of pharmacokinetics except, okay, mechanism of action and increase in activity. Okay, so first option, second option is absorption, distribution, C is metabolism and excretion, D is drug disposition in lipids transportation using plasma proteins. Okay, which is the correct answer? Which is the correct answer? Mechanism of action and increased activity, or absorption, distribution, metabolism and excretion?
A,
Which is A is the correct answer. Very good.
A, sir.
Okay,
A
yes. Correct answer is mechanism of action and increase in activity. Remember, it is except. Okay, following are correct. All of them are correct as far as pharmacokinetics are concerned. Okay, so mechanism of action and increase in activity, they are related to pharmacodynamics. Okay, so in that way, all the others are correct, but wrong answer is mechanism of action and increase in activity. Okay, next question is, read and understand the following sentence and answer the below question. Scientific study of drugs, including pharmacodynamic and pharmacokinetic investigations for evaluation of efficacy and safety of drugs and comparative trials and surveillance of pattern of drug use and adverse effects. So, which is the correct answer? Fill in the gap. Okay, it is fill in the gap. So which is the answer? Is it toxicology, chemotherapy,
clinical.
pharmacotherapy, the pharmacy, or clinical pharmacology? Which is the correct one?
Clinical
Clinical
pharmacology.
pharmacology. Very good. Okay, it is the scientific study that deals with the evaluation of pharmacokinetic and pharmacodynamic investigations for evaluating the efficacy and safety of drugs and comparative trials and surveillance of the drug patterns. Okay, so you are correct. Clinical pharmacology is the right answer. Okay, so now, so shall we go to the next stage, sources of drugs? Okay, so we'll go ahead. All of you are there. Now you can. So we'll go ahead with the next topic, Arshal.
Yes, sir.
Okay, good. Okay, we'll start with the next continuation of the topic, so that, like, we will go ahead with the sources of drugs. So sources of, what are the sources of drugs? See, you may be wondering, like, how to find a drug. Okay, where do we find the drug? Okay, I can tell you that wherever you look at, okay, you look at the sun, it can give some drug. Which is the drug? If you look at sun, which is the drug you can get from sun?
Vitamin D, sir.
Very good, very
Vitamin
good.
D, sir.
If you look at, if you see the air, so which is the drug you can get from air? Hmm? From air.
Oxygen.
Oxygen, yes, correct. Like you are breathing in, breathing out. So oxygen is a drug, right? Now, so then if you look at food, which are the drugs you can get from food?
Nutrition.
All vitamins,
All
minerals.
vitamins, glucose, carbohydrates, protein. See, if malnutrition is there, what will you give? You will give for good food, proteins, right? Now, right? So then if you look at if you drink water, say like for dehydration, what will you do? You take water. Like this, like you can find drugs anywhere and everywhere. Okay, anywhere and everywhere you can find drugs. Okay, so the drugs can be liquids, drugs can be solids, drugs can be gases. Okay, so like this you can see the drugs can be obtained from biotechnology. Okay, biotechnology, isolated cells, or we can use, and then we can modify the genes. Like insulin can be obtained from biotechnology. Right now, next is synthetics. Okay, synthetic form, like you can see, paracetamol is a synthetic product. Okay, paracetamol is a synthetic product. You can synthesize many chemicals using already available like benzene rings, or organic chemicals, inorganic chemicals. Yeah, alcohol is a chemical, right? A synthetic product. Next is plants. We can get from alcohol. Is it a drug or not? Ethyl alcohol, is it a drug? Anyone of you? You can answer. Is it a drug or not? Yes, it
Yes,
is a
sir, it's a
drug.
drug.
Ethyl alcohol is a drug.
Yes,
See,
sir.
yes, ethyl alcohol is used for the purpose of treating methyl alcohol poisoning. Okay, okay, you will learn that ethyl alcohol is used for treating methyl alcohol poisoning. Okay, so this is a very interesting question you will be asked in your examination. Okay, so like this, so synthetic products, then plants. So plants, so many plants are having the drugs. Okay, so ayurveda, Indian system of medicine, it is giving so many drugs for all of us to use. And atropine, so you are going to learn about atropine very soon. Atropine, digoxin, so I told about digoxin is used for heart failure. Atropine is used for many conditions, so as a pre-anesthetic, as a drug for organophosphorus poisoning. So many indications are there, you will learn about it. Then animal sources. Okay, animal sources. Okay, this pig. Okay, so pig can give very good amount of drugs, like which is having pig insulin is very much nearer to human insulin. Okay, so very minute differences are there between human insulin and pig insulin. So beef insulin is also, like we can use, means cow. Next is microbes. Okay, microbes can be one of the important. Uh, Microbes can be one of the most important sources of drugs, like cephalosporins, penicillins, tetracyclines, or chloramphenicol. Most of these drugs, like they are either derived from the plant products, and then synthesized by using the streptomycin. So all these drugs, like they are synthesized for initially extracted from the plants, and then again modified, and then finally they synthesize some synthetic products by studying the structural formula. Then penicillins are there, cephalosporins are there, monobactams are there. So they're all even antifungals are there. So we can get lot of drugs from the microbes. Then minerals, like minerals, what are the minerals? Minerals are like iron is used for what purpose? It is used for treating anemia, right? Now, anemia can be treated with iron. And many, like many drugs like magnesium sulfate, aluminum sulfate. So many, minerals can be, obtained, and they can be used for the purpose of treating. So those, all these are like, those are sources of drugs. So you can see here biospams. Okay, this is the short form what I have derived here. You can see that bio means biotechnology. Spam includes synthetics, plants, animals, microbes, minerals, like this. Okay, so all of them are sources of drugs. Now we'll try to understand plant sources of drugs. Okay, so let us try to understand. You can see that so many drugs are displayed here. Okay, so galantamine, morphine, berberin, then then you can see nicotine is there, then harmine, then you can see caffeine, then physostigmine, so piperin. So like this, like you can see so many drugs useful are obtained even today. Like digoxin is, even today it is used, atropine is used. So plant is a very important source. So plant sources of drugs can be divided into alkaloids. Okay, so alkaloids, morphine, atropine, ephedrine, nicotine, ergotamine, reserpine, quinine, vincristine. So they can be, used for the, like morphine is used for reducing pain. Vincristine is used for treating malignancy. Quinine for treating quinine for treating malaria. Reserpine for hypertension. So like this, like so many drugs can be obtained from plants as alkaloids. Next one is glycosides. Okay, so glycosides, so it contains, like some of the examples are cardiac glycosides, digoxin, auben. Digoxin is used for even today for the purpose of treating congestive cardiac failure. Aminoglycosides, like gentamicin. Okay, so but aminoglycosides are obtained from fungus. Okay, next is sources of other plant sources are oils. Okay, fixed oils, like they can be used as food and as emollients. Groundnut oil, coconut, sesame oil, castor oil for as a purgative, and then essential oils like flavoring agents. We can use them as flavoring agents, carminatives, counter irritants, astringents. Then eucalyptus oil for reducing pain, peppermint oil for as a flavoring agent, nilgiri oil as a reducing pain, clove oil, it is having some anesthetic effects, for the purpose of treating dental pain. Menthol, thymol, camphor, so they're all having volatile oils. So they can be made into solids in room temperature, and we can use gums and as gums and throat pain for the purpose of treating local pains and okay, so resins and balsams also, plant sources are available. They can be used as antiseptics and cough mixtures. And then anti-malarial drugs like anti-artemisinin was also obtained. It is from Chinese plant, and it is used nowadays also. So next is animal sources. Okay, animal sources of drugs are organ extracts. Okay, organ extracts, they started extracting in 19th century and 20th century. So in that way, like adrenaline, thyroxine, insulin, liver extract like vitamin B12, antisera, and few vaccines are obtained from animal sources. Next one is microbe sources like fungi, actinomycetes, bacteria, like penicillin, like all these, microorganisms like fungi, actinomycetes, then bacteria. So they have helped us to get so many important chemicals like penicillin, gentamicin, tetracycline, erythromycin, polymyxin B, actinomycin B. Then vaccines also, we can use these antigens and induce to get the antibodies, and vaccines development also done with the help of these drugs. Then minerals are irons, salts, calcium salts, lithium carbonate, magnesium, aluminum hydroxide, iodine. So all these are important sources even used today also. Then synthetic chemicals like atropine substitutes, adrenergic beta 2 agonists, synthetic glucocorticoids, prostaglandins, benzodiazepines, thiazides, benzoimidazoles, fluoroquinolones. All these are again important sources that are obtained, like synthetic chemicals are obtained from obtained and used even today also. So next is biotechnology products. As I just mentioned, recombinant DNA technology is used for the purpose of obtaining human growth hormone, human insulin, alteplase, interferon, monoclonal antibodies, regulator, regulator peptides, erythropoietin, and other growth factors can be obtained. So many anti-cancer drugs are developed from all these sources. Like biotechnology, again, just to sum up, biotechnology is synthetic method of obtaining drugs, plants, animals, microbes, minerals. All these are important source of drugs. Okay, so just to quickly address few questions, following are the sources of drugs except, okay, which is the, so some of you can you
Cal,
answer? Okay, cal is not a
cal,
Toxins, sir.
compute. Following are the sources of drugs. Okay, biotechnology, synthetic, animals. So cal is not the important source of drugs. It's a it's a method used for the purpose of teaching. Okay, so it's a teaching aid. Following are the alkaloids. Okay, examples are alkaloids. Examples of alkaloids: morphine, digoxin, atropine, ephedrine. So which is the which is, except you need to know that which is the one which is not the alkaloid, which is the one which is not the alkaloid: morphine, digoxin, atropine, ephedrine. Which is the answer? Answer is digoxin is not
Digoxin.
the alkaloid. Okay, it is a glycoside. Okay, so remember, digoxin is a glycoside, not an alkaloid. Okay, next one is identify the wrong statement. Castor oil is a stimulant purgative. Clove oil is used to allay the dental pain. So, menthol, thymol, camphor are volatile oils that are liquids at the room temperature. Artemisinin is a sequeous